This evening we have Dr. Oybek Rustamov, who is our Clinical Director for Adora Fertility in Brisbane, Queensland, and he's on egg freezing. We would like to ask if anyone has any questions. You can either type the questions into the private chat and those questions will be addressed. Alternatively, please enjoy listening to this excellent education by Dr. Rustamov, who is one of our fertility experts, who is a leader in this area of fertility.
Thanks, Jen. Thanks for kind introduction. So, Jen, can you see my screen on the slideshow?
Yes.
Okay, excellent. Who is a leader in this area? Okay, sorry. Okay, yeah, thanks everyone for joining this live stream. Today we're going to talk about egg freezing. Yeah, so, okay, just a little bit about egg freezing before we actually present the whole thing. So essentially, every now and then you have got everything aligned for certain medical treatment or prevention. Like you have a very good medical technology, which becomes very accessible and affordable. And at the same time, large portion of population need to use that service. So this is happening on egg freezing in 2024, because today we have a very good vitrification technology to freeze eggs. Second is, and this is very effective technology. And second, it becomes suddenly affordable and accessible to a large portion of population who need egg freezing. And thirdly, and actually a lot of women need to consider or do egg freezing, given that there's a need to preserve the fertility for future. Okay, so that's a bit of introduction. So I'm going to start talking about egg freezing journey. Okay, so today we will be covering who need to consider doing egg freezing, and how many eggs you need to freeze, and what is involved in egg freezing. Okay, so let us start with who actually needs to do egg freezing. So essentially, women are born with a set number of eggs in their ovaries. They cannot create new eggs after their birth. So, and they can only activate and lose eggs until the age of menopause. So let us say 25% of women are born with very high number of eggs, and they lose their fertility slowly, and they stay fertile longer, and they have a late menopause. 50% of women are born with average number of eggs, and they have an average duration of fertility, and they have a menopause when they reach approximately age of 50. And unfortunately, 25% of population of women are born with a low number of eggs, and they lose egg reserve much faster, and they have a menopause much earlier. This is a group of women who struggle to conceive if they delay their fertility, or they have an early menopause or premature ovarian insufficiency. So this is 25% is a large proportion of women. So so certainly women who in this 25% category, they need to consider egg freezing if they want to start family for a little bit later. So if they complete their family early on, let us say by the age of 30, for example, they may not have any issue. But if they delay their family later, then they may have an issue. So this is why it's very important to understand everyone their own egg reserve. So high egg reserve or low egg reserve is not disease. It is essentially the distribution in the population. Like some people taller than others, so egg reserve can vary. So you cannot do anything about your egg reserve. You cannot create new eggs. But what you can do is you can actually find out your own egg reserve and make a fertility plans accordingly. So how can you do that? You can do that by checking your egg reserve. Okay, let us say at the age of 25, these 20 friends, if they ask about their fertility, they assume they have very similar fertility because their age is the same. But in actual fact, that if you check their egg reserve, they have very different fertility. So 5 of these friends, Jessica, Ashley, Amanda, and Sarah, and Jennifer, have very high egg reserve according to their AMH. and 5 of these friends have a low egg reserve, and 10 have an average egg reserve. So when you track their egg reserve using AMH test or antral follicle count test, if you repeat this test after 10 years, approximately they stay in the same category. So as a result, you can actually predict longer-term decline of fertility of women using simple tests like AMH or antral follicle count. So this is very important. This is very relevant. We are not even talking about getting pregnant now. We're actually talking about making long-term fertility or family building plans using this AMH test. So why is it important? Because initially when we started at the age of 25, 20 friends assume they have very similar fertility. After doing one single test, they can actually know their own egg reserve and long-term prospect of having kids, and they can actually make an actionable plan. For example, Kyla, Melissa, Amber, Daniel, and Taylor, who are in the red line and low egg reserve, they need to actually get on with it in terms of trying to conceive quicker if they're in a relationship, if they're ready to start family. If not, they should be freezing eggs. Or if they're in a relationship, they can be freezing embryos. They need to preserve their fertility. Let us say they want to start family at the age of 35. By then it may be too late because ovaries may not have any eggs left or may have very little eggs left. So then in the higher end of spectrum, Jessica, Ashley, Amanda, Sarah, and Jennifer, they don't need to worry too much because they retain their fertility much longer, and they can simply just monitor their fertility by doing AMH or antral follicle count tests and just reviewing their family building plans. So they don't need to be in a rush. So in the remaining 10 women, so they have average ovarian reserve, so they can also monitor, and they can just check maybe AMH after 2 to 3 years and review their fertility plans. Just one single test can give a lot of actionable information. That's why every woman who want to have kids in the future need to consider doing AMH test or antral follicle count test. Okay, so now we know who actually should consider egg freezing. Actually, all these 20 women can consider egg freezing, but for Kyla, Melissa, Amber, and Daniel, and Taylor, that's actually very urgent. Urgent doesn't mean next month or within 2 to 3 months, but they cannot delay next few years. They need to be making plans to preserve their fertility or start their family. So so essentially this is how you can establish whether you need to freeze eggs. Even if you have a high egg reserve, if you're not planning to have any kids next 10 years, for example, but you want to have kids in your lifetime, you can still do egg freezing. Yeah, so you can still preserve your eggs, then review your plans after 5 years, and you don't need to worry too much about declining egg quality. Same goes for the women with a low average AMH. Yeah, so essentially it prioritizes who actually need to get on with preserving fertility or starting the family if they want to have kids in the future. Okay, so now we have...
Dr.
Yes.
Sorry, Dr. Rasmov, we've just I've just had a message come through from a group of doctors that are watching this from one of the public hospitals. They've asked the question, how long does the whole process take from the beginning to the end for a woman who is wanting to do one cycle? And the other question there that I've had is typically how many cycles would a woman do to achieve one baby?
Okay, excellent. Very good question. Actually, these are the part of my presentations. I can cover both questions. Yes, second question I can cover next, which is how many eggs you should freeze. Yeah, so I will give you example in terms of trying to achieve one child. It really depends on how many kids you want to have and how quickly you are going to start trying to conceive a family. Let us say if you have a plans to conceive naturally, if you have a good egg reserve, the plan A will be to try to conceive naturally. So this, if doesn't work, plan B will be to trying to do IVF using your eggs at the time, fresh eggs. Plan C will be frozen eggs. Yeah, so you need to take this into account. So if you're relying only on your frozen eggs, let us say if you're delaying your family building so long that at the time you may not be able to conceive naturally, or if you can't do IVF using fresh eggs at the time, If you're relying solely on frozen eggs, then to get reasonable chance of having one child, we recommend freezing approximately 20 eggs. So we'll explain how it works. So if you freeze 20 eggs, these are mature eggs which can be utilized for ICSI. So if you freeze 20 eggs, whenever you thaw, after 5 years or 10 years, approximately 95% of these eggs will survive, which means 19 of those eggs will survive. So when you do fertilization using donor sperm or your partner's sperm at the time, approximately 80% gets fertilized. Out of 19 eggs, you lost 4 eggs, then you have 15 left, which is 15 embryos. Then you incubate these embryos for 5 days until blastocyst stage. Then approximately 25-30% converts to high-grade blastocyst, which you can utilize. All the embryos you lose. That's how normal fertility works. You start with large numbers and you end up with a smaller number of embryos, and you hopefully get one child out of so many eggs. So if you, let us say, got four embryos, high-grade embryos, each of them give you approximately 30% chance of having a child. Theoretically, you can have 4 kids, which is very, very, very unlikely. So the cumulative chance of having one child using 4 embryos, which is 20 eggs, is approximately 85%. We think 85% is a reasonable chance of having one child. So if you want to increase your odds of having child using frozen eggs, you need to freeze more eggs. If you add another 10 eggs, you will end up getting 2 more embryos. Then you end up getting maybe 95% chance of having one healthy child. So this is how you can work out. If you want to have 2 kids, you need to just double these numbers. So this is in terms of how many eggs you need to freeze. In terms of how many cycles you need to do is depends on your age at the time of freezing of eggs and your ovarian reserve, which is AMH level. If you have very good ovarian reserve, you can do 1 good cycle and get maybe 10-15 eggs. In a couple of cycles, you can get 20 eggs. If you have very low egg reserve, you need to do multiple cycles to get to this number. So it is really dependent on egg reserve. Okay, so then now answer to the first question, what's involved in egg freezing and how long it will take. So in terms of egg freezing, essentially what we do is we actually stimulate small follicles on your ovaries. So in any given time, women have a number of small follicles in their ovaries. We call them antral follicles. So average antral follicle for the age of 35 is maybe 15. Let us say you have got 15 small follicles. So our job is to block your pituitary gland and stimulate those follicles using hormones. So and getting eggs from those follicles. So essentially, egg freezing has got 4 stages: cycle planning, ovarian stimulation, egg collection, and egg freezing. So in cycle planning, you speak to your GP, you see the specialist, they set you up for the treatment, they create the treatment plan, and you buy the drugs and sign the consent forms and wait for your period. So this can last maybe 2 to 4 weeks. So and then when you have a period, your actual egg freezing cycle starts. You have a period, you do the blood test and inform the clinic. Then clinic nurses will ask you to start the stimulation injections. These are one of these injections. This is a hormone called FSH, which is the same hormone you produce naturally, but in higher dose. You do daily dose of this FSH hormone approximately for 10 days. Towards end of those 10 days, you do blood test and scan in the clinic to monitor size of the follicles and level of your estradiol hormone. So then once you see large follicles, larger than 18 millimeter follicles, then you do the trigger shot for the maturation. Then you come for egg collection procedure. So egg collection procedure, you have an anesthetic and you sleep, and using needle, specialist collects all your eggs in that cycle. It doesn't reduce your egg reserve. It doesn't affect sleeping eggs. Just eggs which are activated will be collected, and then in the lab we separate eggs into 2 groups: mature and immature eggs. Approximately 80% of eggs are mature, and these are utilizable and freezable eggs. Those eggs get frozen same day. Immature eggs don't have a chance to become a baby, and those eggs need to be discarded. So essentially, that's whole thing lasts from first day of menstrual period to egg freezing approximately 12 days. And on the day of egg collection, the cycle it gets completed. So
Dr. Russ,
yeah.
can I ask you, on behalf of all the women that are thinking the same thing, is it possible for women to do this whilst they're carrying along with their normal duties of working and, you know, potentially looking after a house? Is that possible, or is it something that they need to take time off and have rest?
Yes, of course. So they can continue all normal activities. So they can do the scan and blood test first thing in the morning. They really need 1 day off because the day of egg collection, because they will have a general anesthetic or sedation, they can't drive. So it just really requires 1 full day off. So and usually next day the pain subsides, then they can continue normal activities.
And is it painful?
The procedure, most clinics like our clinic at Adora, we do this procedure under general anesthetic. So it's not painful. So then after the egg collection, women may have some discomfort, but generally the recovery is fairly quick.
Thank you.
Okay, so yeah, so that's about it. So
Thank
Jenny,
you. There's
any more
just so I do have a couple more questions there. Just around the medicines that are used. So I've just had some questions come through around: does every woman get the same medication, and is it a low dose, high dose, and how do you decide what dose that you give?
Very good question. Essentially, you need to individualize the dose and medicine to the person. Yeah. So, women with a very high egg reserve, they need to have a lower dose for stimulation. Women with a low egg reserve need to have a higher dose for egg stimulation. Essentially, optimal number for optimal number in terms of getting best chance of pregnancy is approximately 15 eggs. So we just try to drive towards this many eggs. And a lot of women, it may not be achievable if their egg reserve is low, but you give a higher dose to try and achieve higher number of eggs. So yeah, so you individualize. So you use one drug to start with FSH if it's not very effective. So and then you may need to change different drugs. So you really need to individualize to give a best chance of success in terms of number of eggs collected and the quality of eggs in the future when the eggs will be utilized.
I've just had one more question come through. Is egg freezing covered by Medicare in any circumstances for patients who have a medical condition?
So in Australia, if there is so there are 2 different types of egg freezing. One is a privately funded, and the second is a Medicare funded. If the patients with medical conditions like severe endometriosis or certain medical conditions, they may be eligible for Medicare funded egg freezing. So yeah, so if anyone is considering, they need to see their GP and then do all the tests and speak to the local specialist and to discuss if they are eligible for Medicare funded egg freezing.
And one final question has come through. So typically, what age are you seeing women in Australia doing egg freezing? And when is it too late?
Yeah, usually in Australia, the average age of starting family or having first child is approximately 30. So, and then usually women, if they can't start family for career reason, professional education reasons, they start considering family building options. Then this is when usually start seeing GPs or the specialists to discuss different options. And certainly, if anyone wants to have kids in the future, at least they need to do a full investigation to check their egg reserve and have a discussion. Even if women don't want to do egg freezing, still they need to have a very clear idea about their longer-term fertility in terms of egg reserve and the longer-term chance of having kids.
And how much is that the test that you mentioned? Did you say it was an AMH test?
Yeah, so that in Australia Australia, it's approximately $80 to $100. The test can be done through any GP, through the GPs. And then the second test is antral follicle count, is a pelvic ultrasound scan. It's normally done as a gynecologist scan. Women need to ask sonographer to add antral follicle count scan. It's called AFC. So AMH and AFC, these are two best markers for egg result.
Thank you, Dr. Rustamov.
No worries. Thank you. Thanks very much, everyone, for joining or watching in the future. Thank you.
Thank you.
Is it still live? I think yes, live. Yeah. So.